So I'm Dr. Tom Oakley. I'm Chief Executive of Feedback Medical, and I used to be a radiology registrar, now full-time with Feedback. I have obviously practiced radiology and understand firsthand a number of the problems that we face as a specialty, which is really why we have made radiology and image transmission and viewing sort of cornerstone of Bleepa as an application. One of the big challenges we have as radiologists is communicating significant findings in a seamless and efficient way to our clinical colleagues on the front line. One of the things that we have done with Bleepa is to enable you to very easily and quickly send a message to colleagues about significant findings with a complete audit trail, read receipts so that you know that they've been actioned by the clinical team, and also facilitating a bi-directional conversation through messaging linked only to one patient at a time, so that your clinical colleagues can actually come back and ask you for further information directly in a way that doesn't actually interrupt your reporting lists. You're not having to jump onto the phone to chase colleagues anymore. You're able to just send them a dedicated direct message, even with an image annotation, and then that will go straight to your team members. I think there are quite a number of frustrations for working radiologists today. I think that particularly interaction with colleagues around vetting and requesting of imaging studies, and also communicating significant findings to the named individuals that you need to get that information to, are two quite fundamental challenges that aren't really addressed at the minute. Currently, if you're practicing and you need to either speak to a colleague or to transfer over some advice and guidance, you're having to do that largely by the phone, or if the individual comes down to the radiology department in person. One of the things that we really want to transform with Bleepa is the ability to seamlessly have that dialogue with clinical colleagues from the comfort of your own reporting seat, without having to get colleagues to come down from all around the hospital to see you in person, or without having to chase them through hospital switchboard. It should be as simple as, I have seen this important finding on the study, and communicating that via a message straight to colleagues, and then knowing immediately that it's being actioned. So one of the things that Bleepa does by having that messaging interface is it gives you the confidence to know that not only have you conveyed that information to ensure that it's acted upon, but that there is actually already an automatic record of that conversation, which is fundamental. I think that actually during COVID, we saw a real need for this sort of interchange with our clinical colleagues. Typically, people come down to the department when they want to talk to us, and of course, they're coming from a number of wards, bringing all sorts of infectious diseases such as COVID down to the department. So if you're the duty radiologist, you're right in the firing line for all of the rare and wonderful transmissible diseases coming off the wards. And actually, it's not an efficient use of the clinician's time or your time as a radiologist. It's much better to have a dynamic exchange based on instant messaging, so that you can reply to colleagues and pick up on questions in between your reporting, so that you're not disrupted when you're reporting, and you're able to actually give their clinical question, their clinical concern, the amount of time and attention that it needs.